Hey there, my name is Sarah, and I am the current COVID Navigator here at MobileMed. I track all of our COVID positive patients. So by tracking, I mean, I check up with them a few times a week, just, make sure they're doing okay. Checking in to see how they are symptom-wise, making sure they're aware that if they have any severe symptoms, like for instance, shortness of breath or chest pain, to go to the emergency room. So with my job, I do a lot of education about, staying home, how to care for, having COVID-like symptoms. A lot of it is just reassuring patients that they're going to be okay. I think with our patient population being, low income, I think when, patients find out that they're COVID positive, they immediately start just automatically assuming the worst. And I would say it definitely affects our population a lot more because, when they get COVID, that means they're going to be out of work for 2 weeks. And most of the patients are more worried about when can I go back to work? When can I go back to work? And, having to educate them on staying home because that's the only way that this pandemic is going to stop is if people, do the correct procedures and stay at home. But like I said, with a lot of our patients, it's comforting them. Also working a lot with our partner Unitas. So with that, putting in referrals to help get food, rent assistance. So it's going beyond just checking in on them and their, medical symptoms and medical history, making sure they're doing okay, but also their personal lives. In the beginning, it was, so unknown, but, by this point, it's really working with people to make sure they're staying home, making sure that they get the medications that they need. Early on in the pandemic, we were doing medication deliveries to the patients' homes, which was really great. So working a lot with the providers and the patients to making sure, they were taking all their medicines and making sure they were following up appropriately with the doctor via telehealth, not coming in person, to pick up their medicine. We would, advise them to stay home and they could just simply, log on a computer and talk to the doctor with telehealth. So, I help put them at ease and just knowing that we're so well connected, through technology and communicating through our patient portal system so they can send a message to their provider or send me a quick text message and ask me a quick question has been really, really, really good to get, our patients through the pandemic. So overall, it's been a very wild year, but definitely been very thankful for, being able to do this position and help probably over 200 people, with our COVID diagnosis in our clinics. It's been about 200 people that I've worked with and been able to help. So thank you so much and have a great rest of your day.